Just because you're in perimenopause and you're having hot flashes, and your doctor says you need to be on HRT even though I haven't tested your hormones, that might not be a good idea. My name is Dr. Gabrielle Francis, and welcome to my series, Empowered Menopause. Today we're going to talk about HRT in perimenopause and how to determine if that's right for you or not. Let's go. Many women ask me about hormone replacement therapy during perimenopause, and in general, most HRT is not recommended during the perimenopause time, but if it is, it has to be based on if your hormones are low. I don't recommend just taking HRT, hormone replacement therapy, if your hormones are not low. They need to be tested. And what we typically see is that people often have very high estrogen levels and very low progesterone levels. And there can be other kinds of imbalances as well. So really, during hormone replacement therapy, it has to be monitored and based on testing that your hormones actually need them. Perimenopause is a time where the herbal phytoestrogens and phytoprogesterones can work very, very well. They have a much safer way of working, and they tend to help balance people without taking the HRT. If you're having a lot of hot flashes, just because you have hot flashes doesn't mean you should be on estrogen. You need to get your estrogen tested. It's funny, but a lot of times people who have high estrogen levels and are getting hot flashes will feel better on hormone replacement therapy. And that's because the hormone levels are not fluctuating any level. They're being flatlined by the hormones they're taking. The hot flashes are coming from the fluctuating levels of hormones, not necessarily because they're too low. So when you're determining if HRT is right for you with your doctor, insist that you're getting your hormone levels tested and monitored during this time so that you're only taking what's appropriate for you.